Hi everybody, what is cognitive behavioral therapy, CBT, and how is it different from talk therapy or from counseling? Today, we're talking about the basics of CBT, and I'm super excited because I have spent more than 10 years delivering CBT to clients and conducting academic research. So I've accumulated a lot of knowledge and I can't wait to share it with you. Hi everybody, I'm Dr. Amelia Aldeo. I'm a Yale-trained clinical psychologist, and I'm also a former research professor at Ohio State. I used to be the director of a lab studying anxiety and depression. And I specialize in CBT, so I'm super excited to tell you all about CBT today. So what is CBT? When I think of CBT, I think of 4 core principles. The first one is collaborative empiricism, and I know that's a mouthful, but that's basically the idea. The client and the therapist collaborate, work together to better understand how the client is doing, what symptoms they have, and what type of exercises they need to be learning. This is different from traditional talk therapy or from counseling because in those contexts, the therapist or the counselor tends to provide a lot of advice, tends to be very directive. Whereas in CBT, we actually teach our clients skills so that they can become their own therapist. It's the idea of teaching somebody how to fish instead of giving them the fish. The second principle of CBT is the cognitive flexibility piece. Here, we teach our clients how to think differently. When we go through difficult situations or experience intense emotions, we tend to have really intense and extreme thoughts. And in turn, those thoughts make our emotions more intense and make everything more difficult. So in CBT, we teach our clients to think about stuff differently. Let me give you an example. Let's imagine that you're very anxious about giving a talk at work. You give the talk and it doesn't go that well. Now you're having all kinds of anxious thoughts. Oh my gosh, that went terribly. Everyone is gonna think I'm stupid. My boss is gonna hate me. My boss is gonna fire me, and so on and so forth. Now we take a step back and we look at those thoughts, and they seem to be out of proportion with what just happened. You simply gave a talk that wasn't so great. So as a CBT therapist, I would help you think about that differently. For example, what evidence do you have that your boss doesn't like you? And do you have evidence perhaps that your boss does like you? What would you tell a friend going through a similar situation? Is there a different way to think about what just happened? And so on and so forth. So you could see that we're teaching clients how to think differently, how to adopt new perspectives, how to embrace uncertainty. The third piece of CBT is the behavioral piece. So CBT is not just about learning to think differently, but it's also about behaving differently. So let's imagine that now you're so anxious about giving talks that you begin avoiding them. And this is a problem because it's a big part of your job. So it's gonna have negative consequences. So what do? We do exposure. This is a process by which we're gonna test, and you're gonna try giving different talks in different environments to different people so that you can get your anxiety to come down. The more we face our anxiety, the more it usually tends to go down. I should mention though, you should always do exposure exercises with a professional. And the fourth principle of CBT is homework. And this is super important because clients spend about an hour a week in therapy, and there's another 167 hours every week in which they could be practicing cognitive and behavioral exercises. I like to think about it as going to the gym. Imagine that you book a session with a personal trainer and you get a great workout. That's fantastic. But if you want to see results, you have to keep showing up at the gym and you have to keep exercising in between the sessions. CBT is exactly the same. So a good CBT therapist will work with you, will collaborate with you to help you develop cognitive and behavioral exercises that you can practice at home. Wow. All right, so that is all for today. If you guys have questions, if you have topics that you'd like me to cover, please let me know by leaving a comment in the section below. And as always, I have a small ask. Don't forget to like the video, subscribe to the channel, and share. Thank you very much, and I'll see you guys next time. Bye-bye.